Hi, I'm Dr. Roger Smith. I'm an upper cervical chiropractor in Huntington Beach, California. I've been helping difficult cases get well for over 10 years now. Difficult cases like facial nerve pain or trigeminal neuralgia, and it's one of the difficult conditions that I've helped. Upper cervical health care is a non-surgical and non-pharmaceutical treatment that helps patients with trigeminal neuralgia and other conditions, but without any of the side effects. In upper cervical health care, we focus on getting to the cause of the problem, not just treating the symptoms. And we do this with a very gentle but very specific adjustment. It doesn't involve any twisting or popping or pulling or cracking of the spine. And since it is so specific, we adjust about 90% less than most chiropractors. Now, if you've been dealing with trigeminal neuralgia for some time, you've probably been given many or several different medications. This is the first line of treatment that's always medication for trigeminal neuralgia. Now, this can help with the pain, but there's side effects that's difficult to deal with themselves, like the dizziness, the drowsiness, the forgetfulness. And these drugs do nothing to correct the cause of the problem. If the drugs aren't working, then you may have been offered a surgical procedure, one of several surgical procedures like the Blvd, which is the microvascular decompression, or the gamma knife surgery. Now, these surgeries can help with the pain, but they're also very invasive. Like the microvascular is actually a hole that's drilled through the head where they go in and actually put Teflon in between the nerve and a blood vessel to help decrease the sensitivity of the pain. The gamma knife, which actually destroy the nerve so that your body does not transmit that pain, but you can have numbness or paralysis because of that. Even the University of San Francisco, on their website for the Department of Neurological Surgery, second line they say is that surgery should be used as a last resort, because even minimally invasive surgeries are riskful. And so wouldn't you want to try something less invasive first? Now let me grab this book here. You may be familiar with this book, Striking Back, which is the trigeminal neuralgia guide, or a lot of information about this. It's the most complete discussion of the condition, and it has a study in here by Dr. Weigel Casey. This is in the year 2000. He studied 68 trigeminal neuralgia patients. Of those 68 patients under upper cervical care, I believe 73.5% of them saw a complete decrease in the symptoms of the trigeminal pain. 21% experienced a reduction in pain. Only 6% saw no relief from the pain after upper cervical care. Now, those are very good odds that if you're dealing with this condition, upper cervical care may be a good solution for you. Now, not many procedures have that kind of success rate, and so that's when it's really good for trigeminal patients or facial nerve pain patients to at least try upper cervical health care and see if there's pressure on the upper neck or brainstem, which is contributing or adding to the trigeminal pain you're having. You owe it to yourself just to find out if there's something going on there that you can do naturally without any side effects. The only side effects that upper cervical health care has is the pain going away and your health coming back. You can get your life back. You've been suffering for too long with this. This pain is too intense, and the upper cervical health care can actually make a difference. So to get the information you need to follow through and get this taken care of, go to my website at www.rogersmithdc.com. That's rogersmithdc.com. I'm Dr. Smith, and your health starts here.